The RENASYS Soft Port replaces traditional plastic tubing with a soft, conformable, compression-resistant alternative. The system reduces the need for complex bridging, reduces patient discomfort and pressure points, delivers negative pressure even when kinked. The RENASYS foam wound filler must be cut away from the wound cavity to avoid foam fragments falling into the wound, and then be put in place, completely filling the wound cavity. Cover the wound filler with transparent adhesive film, removing the remaining panels to seal, then the top stabilization panel. The film should extend at least 5 cm or 2 inches beyond the wound margins and be securely anchored to the peri-wound area to maintain a good seal. When using multiple pieces of transparent film, overlap the edges by a minimum of 7.5 cm or 3 inches. Cut a circular opening no less than 2 cm or 1 inch in diameter in the center of the film, over the wound filler. Remove any loose transparent film and dispose of away from the wound. Remove the adhesive panel from the RENASYS Soft Port dressing and align the port opening directly over the hole in the transparent film. Use gentle pressure to anchor the soft port to the transparent film. Smooth the dressing down while removing the RENASYS Soft Port's top stabilization frame. Position the RENASYS Soft Port tail according to the patient's comfort, and ensure the aeration disc located near the quick-click connector is not covered or otherwise occluded by the method used to secure the soft port. Connect the RENASYS Soft Port to the canister tubing by pushing the quick-click connectors together. An audible click indicates the connection is secure. Activate the RENASYS device. Adjust to the prescribed therapy level. The finished dressing should be firm to the touch and leak-free. The soft port will continue to deliver negative pressure wound therapy even when the patient sits or rolls onto it. However, consider further pressure injury prevention strategies when using any medical devices, such as assess the skin under and around the medical devices for signs of pressure-related injury as part of routine skin assessment. Regularly rotating or repositioning the medical device will reduce and/or redistribute pressure at the skin. Even when the soft port is under the back of the patient or mannequin, there is no therapy interruption or alarm using the RENASYS Touch device. The RENASYS Soft Port tubing ensures negative pressure is delivered from the pump to the wound.